The thyroid is a small-sized gland found in the lower neck of the front, just above the collarbone. The thyroid resembles a butterfly, as it has two lobes, the right lobe and the left lobe, which fall on both sides of the trachea. The thyroid is part of the body's endocrine system, and is responsible for balancing the functioning of different organs of the body, producing two main hormones, thyroxine and thyroid-stimulating, which perform many functions in the body, and secreting another hormone called calcitonin. The functioning of the thyroid gland and its production of hormones are regulated through the pituitary gland of the brain. The thyroid gland responds to the pituitary hormone known as thyroid-stimulating hormone, thyroid-stimulating hormone, to modify the excretion of its hormones in the blood, whether by increasing or reducing their production. Thyroid affects many vital processes and has a role in regulating the work of many organs of the body. In general, when thyroid hormones bind to their receptors within the nucleus, this will activate many genes that eventually increase metabolism and heat generation. Thyroid functions in the body can also include increase the underlying metabolic rate and increase the number of calories the body needs to work at rest, regulate the process of burning calories in the body, activate carbohydrate smashing process, increase the process of building and making proteins within the body, increase the process of building or breaking down fat inside the body based on an individual's metabolic condition, control body temperature and maintain its survival within normal levels, maintain normal heart rate, regulate respiratory work and oxygen levels in the blood, support the normal development of the body, especially the nervous system in children, support bone health and growth well and maintain blood calcium levels. Thyroid functions can also include regulating ovulation and menstruation, as well as affecting an individual's fertility. Thyroid function can be affected when it has certain diseases or health problems. Thyroid disorders can occur as a result of dysfunction or pituitary disorder in the brain, and in other cases as a result of a thyroid disorder itself. Hyperthyroidism. In this case, the thyroid gland produces excess amounts of thyroid hormones, which is more common in women than men. GRIF is the most common cause of hyperthyroidism, with approximately 70% of patients with hyperthyroidism suffering from GRIVs. In other cases, with age, thyroid nodules form, and some of these nodules can respond to the brain's pituitary hormone, which regulates the functioning of the thyroid gland. This response results in the production of nodules for thyroid hormones, increasing levels of thyroid hormones in the body called toxic nodule or polynodule thyroid. Hypothyroidism. Hypothyroidism is a pathological condition adverse to hyperthyroidism, in which there is a lack of production of thyroid hormones. Hypothyroidism usually occurs as a result of Hashimoto's disease, or after thyroid gland removal surgery, as the thyroid may be injured during surgery, or as a result of exposure to radiotherapy in the head or neck, which in turn affects the thyroid gland and damages its cells, thereby reducing the production of thyroid hormone. Enlarged thyroid gland. Thyroid enlargement or swelling occurs as a result of hyperthyroidism, or hypothyroidism, and in some cases, thyroid function may not be affected if swollen and increased in size. The deficiency of iodine used by the thyroid gland in the production of its hormones is one of the most important causes of thyroid enlargement. Another cause of thyroid enlargement is Hashimoto's disease and Graves' disease. Thyroid nodules are tissues that grow in the thyroid gland to be solid nodules or fluid-filled bags, and thyroid nodules are very common in older people. Although thyroid nodules arise as a result of a thyroid tissue problem, they rarely affect thyroid function, so thyroid function is usually normal in people with thyroid nodules. It must also be borne in mind that thyroid nodes are often not cancerous, and do not necessarily mean thyroid cancer. Thyroid inflammation often occurs as a result of a range of disorders that result in the immune system attacking and inflaming the thyroid gland. One type of inflammation the thyroid can infect is Hashimoto's thyroid inflammation, which is a cause of hypothyroidism. Pregnancy and childbirth in some women can cause thyroid inflammation after birth, and this inflammation causes temporary thyroid activity followed by temporary thyroid laziness. Taking some types of drugs can also cause thyroid inflammation, such as amiodarone, interferon, and in a few cases viral or bacterial infections may be behind thyroid infection. Thyroid cancer occurs as a result of thyroid cells becoming rapidly fragmented cancer cells that do not die like normal cells, resulting in tumor formation. The cause of thyroid cancer is still unknown, but many factors can increase the risk of thyroid cancer, such as exposure to head or neck radiotherapy, exposure to radiation sources during childhood, a personal history of thyroid enlargement, and a family history of thyroid enlargement, and a family history of thyroid disorders or cancer. Thyroid symptoms vary according to the patient's thyroid disorder. Symptoms can include symptoms of hyperthyroidism, neurological rapid mood fluctuation, rapid heart rhythm, frequent sweating, anxiety, insomnia, thin skin, fragile nails and hair, weight loss, heat intolerance, and eye sensations, especially in those with Graves' disease. Thyroid lethargy symptoms, frequent feeling of fatigue, dry skin, increased sensitivity to low temperatures, constipation, weight gain, slow heart rhythm, drowsiness and sleep, depression. Thyroid hyperthyroidism symptoms, swelling at the front of the neck, feeling tightness in the throat area, barking or rough sound, having difficulty swallowing or breathing. Thyroid nodule symptoms, having a lump or swelling of the neck, experiencing difficulty or pain when swallowing, difficulty breathing, inertia or rough sound. Thyroid inflammation symptoms. The inflammatory thyroid symptoms depend on the effect of inflammation on the thyroid. If inflammation causes rapid destruction of thyroid cells, the patient may suffer from symptoms of hyperthyroidism. If chronic inflammation slowly destroys thyroid cells, the patient may experience symptoms of hypothyroidism. Thyroid cancer symptoms. Thyroid cancer does not cause symptoms in the early stages, but as the condition progresses, the patient can suffer from a lump in the neck. This mass may grow rapidly at times. In addition to swelling of the neck, neck front pain, palm or sound rough, difficulty swallowing, difficulty breathing, and persistent cough. The clinical examination of the neck and the following tests help diagnose the patient's thyroid disorder. Analysis of thyroid-stimulating hormone level. Analysis of T4 and T3 hormone levels. Thyroid antibody analysis. Ultrasound neck imaging or CT imaging. Thyroid absorption examination of radioactive iodine. Take a biopsy of the thyroid. Thyroid treatment also depends on the type of disorder experienced by the patient, and treatment methods can include the following. Hormone replacement therapy in cases of hypothyroidism. Use anti-thyroid drugs to treat hyperthyroidism, such as methimazole. Radiotherapy in cases of increased thyroid activity, thyroid nodules, or thyroid cancer. Thyroid removal, or part of it, in cases of hyperthyroidism, thyroid cancer, and thyroid nodules. Chemotherapy and radiation in cases of thyroid cancer.